All right. Hi, students. This is Dr. Denicola for one of our social work and human development chats. And today, my friend that I convinced to talk to me is Kelly Moon. Dr. Moon is a faculty member here at LSU. She's been here since 2018 after getting her PhD from University of Maryland. And her background is in parenting programs and child welfare. And so she's going to talk to us about her experience, some research she's done, and what she recommends for new social workers who want to work with diverse populations and to help them with parenting. So, welcome, Dr. Moon. First question, tell us about your shirt.
It says, girls just want to have funding for scientific research.
I love it.
Because we don't talk enough about women in sciences and women in social sciences, because social science is a science and social work is a science.
Absolutely. Absolutely. And we need the green for our research.
We absolutely do. And we are not funded for the impact that we have. We're not adequately funded or valued.
Right. Yeah. So tell us, what do you do at the LSD School of Social Work?
Well, right now I'm an assistant professor and I teach and I do service, and I am working on my research agenda where I look at various ways to prevent child maltreatment. A lot of that has to do with focusing on parenting interventions, and I look at community and cultural factors and how they impact parenting and child maltreatment rates.
Okay. That sounds really interesting. And I'm going to ask you a little bit about your research in a minute because the things that you've done, especially with your dissertation, are very cool. And I think that our students would be interested in learning more about it. But before we get there, tell us, what did you do before you were an academic?
It's interesting because I actually fell into academia. This was not my plan. I worked direct service for a long time. I worked with kids in foster care and worked with kids as a crisis interventionist for child sexual abuse cases at a child advocacy center. And then I went from there to work and direct a child abuse prevention program, um, which was training people to be parent mentors. And so from there, I actually accidentally fell into academia because my agency was running out of funding, and I inserted an ad in the newspaper of all things because we used to do that for somebody to help evaluate parenting programs, and they hired me because I had the practical experience from running parenting programs.
Hmm. So that's really interesting. So they really valued bringing you onto the research team with your practice experience. And so before then, you maybe hadn't even seen yourself as a researcher.
No, I liked research, but it was not my focus. I was really interested in service delivery and design.
Hmm.
And then it was a natural fit to move from there into program evaluation to really understand how the design and interventions were actually working and to understand how they work, which a lot of that we still don't know and we're still discovering all the time.
Okay, great. So tell me more about your dissertation. What did you do with your dissertation?
So my dissertation was also not initially in the plan, and it was kind of a random thing that several things came into confluence, came together to help me figure out what I wanted to do. The time I was working on a parenting program in Baltimore. And as I was working with the parents and we were looking to adapt a parenting program to these parents' specific needs, I started looking at the research and I found I could not find anything in the research, in the scientific literature around adapting parenting programs specifically to parents in distressed urban communities. It just wasn't out there in the evidence base. And it just struck me because I also have a background in teaching human development and family studies, how little our understanding of adaptations of parenting to different cultural contexts had then become a part of the literature that we look at when we talk about parenting programs. They're very, I think things outside of dominant cultural context tend to be pathologized, and we sort of have this white middle class ideal of parenting that this is the one way to parent, and it's really not adaptive to every context and every family.
Hmm. My
That's where it came
students
from.
have been learning about that and um, with the idea of looking cross-culturally in different countries, but even within our own country, we every family has different values and particularly, different ethnic and racial groups. And depending on what kind of resources a family has, it can really affect how they parent and what works for them and what doesn't.
And the primary goal of most parents is to have their children survive. One, you survive, that comes first. And then you move up and then you adapt them so they can be independent and move in society. Well, not every kid lives in the same world, right? So you need different things to survive and different strategies and different types of parenting to survive different contexts. And I couldn't find the research that I needed. It didn't exist. So when I was looking for my dissertation question, um, I stumbled on an opportunity, and it was a really unique. I was very lucky that I got to do this for my dissertation, a really unique opportunity to connect community factors to an existing data set.
Awesome.
Um, so the data set is started in the 1990s, and it's called Long Scan Longitudinal Studies of Abuse and Neglect. And they followed kids from basically a group of five different studies coordinated together to follow kids from birth, and they're still following them.
That's
Okay.
awesome.
So it's longitudinal, and they collected data every 2 years, and they connected it to child maltreatment data and to all sorts of other things and school data. And it's this really rich data set. But one of the things they did not do was go back and connect it to where the kids actually lived. So what I was able to do is I got special permission to dig in the archives and figure out where each of these kids lived at different time points.
That sounds complicated. What was that process like? Did you run into any issues?
Very much so, very much so. And I got to
You
see a
were
lot.
using secondary data.
I was using secondary data, but I was and connecting it to census data. And like it was the data was dated. So when I was looking back and things, there were street names that didn't exist anymore, or housing projects that had and high rises that had since been demolished. There was a bit of historical uh, mystery going on there in what happened with the kids, and then following them all the way past 18. Um,
So the longitudinal nature of the data really helped you to tell a story about these kids and these families over time.
yeah, and what I did for my dissertation is I tried to look at so when we think of kids, kids are not in a bubble. They're in a whole ecology, and that's one of the things you often talk about human development. And in social work, we tend to think of that as being in systems, and we look at human behavior, social environment. So it's really looking at these wider environmental and family factors, how they all come together, and to what extent living in certain neighborhoods or certain areas and what's going on in that neighborhood impacts their long-term trajectory in terms of how likely they were to be reported and found to be abused or neglected, how their parents reported whether or not they were abused or neglected, which is something different, and how the child's self-report was. So it was three different things. And guess what? Those three things do not often match up. So,
Mhm.
so I looked at the three different sources, and some of the things that we found was that, yeah, the neighborhood you live in at 6 seems to have some impact on their likelihood of experiencing certain types of neglect later.
So that's really interesting, and it shows how I think, correct me if I'm wrong, but since you're using multiple sources of data and you triangulated the data, you realized something new about your research question that the sources didn't match up. So that changed how you had to think about your hypothesis.
Absolutely, because it was. when we looked at neglect, it wasn't as if they've been reported for neglect. It was more their self-report of what had happened to them.
Interesting.
So you can't, so, and a lot of child maltreatment research relies on our surveillance systems like Child Protective Services, which don't catch all the cases,
Right, right.
right? And so when you look at all these from different aspects, you start to wonder, are these different phenomena that they're not coming to attention? Because we know there tends to be uh, some kids are more highly surveilled than others, is probably a fair way to say it, for many reasons. This particular group was incredibly high risk, considered because of where they lived and what they were recruited for, and the nature of the sample. And one of the drawbacks of the research is almost all of the children in this particular study lived in high risk neighborhoods. And when I say high risk neighborhoods, it's neighborhoods with high levels of crime, lots of issues, low wealth, all these other kind of urban blight that folks talk about. Um,
So I imagine, connecting back to something that you said earlier, that for parenting, your first job is to help your child survive. And so if you're living in a neighborhood like that, there are many more barriers or many more risks to survival for your child. And so whenever people say our society values reading or education, it's great if you live in a neighborhood where you're not worrying about whether your kid is going to get hurt or even shot if they go and play on the playground, or if they're going to get asked to run drugs to other neighborhood kids. That's a lot different parenting than if you live in an area where it's more secure.
Absolutely. I always tell a story as an example. My son, when he was little, there was construction in a neighborhood and he wanted to go see the construction equipment. And I told him he had to wait. And I turned my back for a minute, and he had managed to get through two locked doors and was out in the street by the time I caught him. 2 minutes. He was not even 3 years old yet. Do you know what happened? Nothing.
Nothing. Yeah.
I grabbed him, I brought him inside, and boy, was he mad. That was the extent of, what happened. Now, if I was living in a different type of environment, that outcome might not have been okay. So one of the things we really talk about, and when we think about parenting, is that when children are in environments that cannot be trusted to manage their safety, obedience is much more important, because they have to be able to listen to their parent and say, if parent says, no, stop right there, they have to stop immediately and be obedient. And the parent has to have a high level of control over the behavior of the child in order to keep them safe. That's not as true everywhere else. And that's one of the things that is environmentally and culturally dependent about parenting, that we often judge and say, well, being so, you know, direct and bossy to your kid, we say, well, that's not great, parenting, and that's not long-term great outcomes. Well, in some contexts, that is what gets you living long enough to have a
And
great outcome.
that's so interesting that you brought this up, because in one of my talks with Dr. Harmeyer, her research is on parenting stress and parenting outcomes as well. And one thing that she talked about was the theory of parenting autonomy, or self determination, and how there that is really should be a guiding tool for parents, and it's an ideal. And how would you recommend parents to be able to still use that in those kind of settings? It'd be much harder when safety is a concern.
It assumes that you have a certain amount of control over your environment, that the kid is safe within the confines that you describe. Not every parent has that much control over their environment. And in order to have that control, you have to have resources and support. And not every parent has the same level of resources and support. I mean, there's a huge variation. And so these strategies have to vary. And I think problematic when we assess parents saying that this is our ideal or this is the norm, and then penalize them for behaviors that actually help long-term survival
Mm-hmm.
or meeting, short or meeting shorter term goals like immediate compliance. We have to really think carefully about how we do that.
Right. Right. So, I know in your dissertation that you used some kind of innovative research techniques, and one in particular was GIS, which stands for Geographic Information Systems, right? Yeah. So tell us a little bit more about what that is and how you used it.
It is the coolest thing, and it's very much fun to play with. Um, Geographic information systems is just a way of visually representing and stating the spatial relationships between things. And it is really great for understanding communities. So, like, for example, in the community that I mapped where these kids lived, I could tell where the kids were concentrated. And they were concentrated in neighborhoods that had the highest amount of poverty or residential instability. And there are all these other aspects of neighborhoods that tend to be associated with distress, right? So when you see that all the kids are concentrated in this area, it's a much more direct visual representation, and you can also measure it. GIS is also wonderful because when you're doing social work, because it can really show you, well, how hard is it for you to get to that resource?
Mm-hmm.
How long do you have to travel? What do you have to travel through? Um, how concentrated are these services?
A visual way to show inequality. Yeah.
Exactly. And a really big part of that is racial segregation, because in the United States, our cities are incredibly racially segregated. Particularly,
Baton
Baton
Rouge
Rouge
is the perfect case study for that.
mhm, and the city I used to work in, Baltimore, is another example. Baltimore was one of the first to have racial segregation codes. Baton Rouge developed it a little bit differently, but New Orleans and Baton Rouge are actually two of the most segregated cities in the South. And
Maryland's considered the South, huh?
South. Baltimore, it's really funny because it depends on who you talk to whether or not Baltimore is the South. I say Baltimore is kind of the mid-Atlantic, but not everybody agrees with me.
They've never been to Louisiana, apparently.
No, 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 the South, the Gulf South. I've
Yeah.
learned that determination too.
So I can remember, Kelly, you come into one of my classes and talking about your dissertation and what you mentioned about where clusters show up of where kids live. Share the example about where the men in the neighborhoods were.
Okay, so this is census data dating to 1990s. So you have to think about this is the war on drugs at its height with the crack epidemic, or so it was called at the time. So one of the things, and you find these really anomalous things, if you play with data enough, you start to look at numbers and you start to see patterns. And I had this one outlier of a census tract that I was like, okay, in all these surrounding neighborhoods where the kids were living, there were no men living in the neighborhoods between 18 and 65. They just weren't there. And I was like, what's this? And then I had this one outlier of a census tract where it seemed that all the men in the entire city were living. And
Where
I was,
were they?
well, when I mapped it, I said, oh, that was where the county jail was, or the city jail. So all the men were incarcerated.
Yeah, so I'm sure that that changed the direction of your research or what you were thinking, so you learned something new about this neighborhood that you might not have learned without GIS. Something you could have found out other ways or interviews with people, but And showing it visually can have a much greater effect, especially when we're trying to change policy. I find that it's a better tool for using in legislative advocacy because people want to see it. And if you use too many big words and academic explanations, it's hard for people to understand. But this is so obvious. It's like here is this cluster of men in one census tract, and it's where the jail is.
It's where the jail is, and they were not in these surrounding neighborhoods.
So that means all of those children don't have male role models that are in their homes. Yeah.
In addition to many other, in addition to high levels of poverty and, frequent moves and all the other things that we know happen in neighborhoods that are probably not the healthiest.
Right.
Another
And
aspect,
the extra stress that leaves on, the partners, the caretakers, the women in the community.
well, and that's one of the things when we look at it, we commonly measure that as something called childcare burden, which it's about the number of active adults who are there to available to provide care to children and seniors, really is what it is. And in a community where you don't have that many adults to care for the kids, that right there creates a different type of surveillance in the neighborhood to watch out for kids.
So that means older kids have to watch younger kids sometimes too.
Sometimes the older kids are not the best ones to watch the younger kids. But it also impacts the community and how it's knit together, because one of the things I also look at is collective efficacy, which is the idea of a community being able to come together towards a goal. And we believe a lot of times that even in distressed neighborhoods, if you have collective efficacy where you have neighbors who watch out for each other and watch out for children, that can be protective of kids.
Hmm.
And so that requires a certain sense of community. And what we're finding is there are different ways to create that. Um, and there's some interesting research on that in terms of how to create that, because these networks happen naturally, but they can also be put in and they can be structured through interventions. And that's something I'm very interested in seeing happen.
Yeah, and this really highlights the importance of including youth voices in community efforts because too often youth are written off as a problem, as a crime problem in their neighborhoods. They aren't engaged often in community efforts, and they are the majority. They probably outnumber the adults, and it kind of goes back to what you were saying earlier, though, is that the adults have probably learned that they have to keep these kids safe by control because and there's so many immediate threats to them. And so that creates a unique dynamic as youth get older about their connection to their neighborhood. We have too many people who end up leaving the neighborhoods that could really be um, something that helped change the neighborhood around.
And we're not investing in these neighborhoods is the other part of it. We're not putting jobs or transportation in these neighborhoods. So it's the resources flow out and they don't come back, but yet the people are stuck there. Um,
And I don't blame them. I mean, if you had the resources to not have to live in a place like that, then I mean, you're really making a conscious choice and that's what you want to do. And then you're thinking about your own kids and what kind of life they'll have.
I think one of the most important lessons that I took, and this was from this all this work converging together when I was working with the parenting program, is I had one woman who got very upset because we were talking about corporal punishment, and corporal punishment is not constructive. There is no research ever that says it's a good idea and it helps develop kids developmentally. Um, there is some evidence that say it's more or less harmful to varying degrees. And so one of the things we often advise parents is corporal punishment is not your best choice, and it's not a great idea on any level. It doesn't really meet your goals, right? For a parent. Well, this one woman stood up in class and said, she's like, you're telling me I can't hit my kid, yet the police can jack them up anytime.
Hmm.
This was right around 2015 in Baltimore when we had the Freddie Gray case, where he was given a rough ride in the back of a police van and the resulting civil unrest. And her point was completely valid. You
Right.
know, her point was valid, and that was her real lived experience. She lived with violence in every aspect of her life, including from the state. And then the state was coming to her and telling her, no, you can't hit your kid. But the police can do whatever they want to him.
Right.
The young black male. And that was her point. And she was absolutely right in terms of how context matters.
Right.
So that really showed, I think, a lot about her reality that you wouldn't have heard unless you talked to people and you got beyond the numbers, which is always the story that I think that as researchers you get stuck in the numbers or stuck in other places where you don't get down to those types of lived experiences. And that's why social work research is so important, because we're uniquely qualified to do both.
Right. Yeah. So, from your research and your practice experience, what would you say to our MSW students who want to be advocates for kids who are at risk, or and particularly working with their parents and helping parents with uh, good parenting strategies?
Always approach with a large dose of humility, because I can guarantee you don't know what you think you know. Nobody ever does. Nobody ever
Mhm.
does.
I
And
definitely can say that about parenthood in particular. I had so many ideas before I was a parent about what parenthood was like. And also now that I'm a parent, realizing that other parents' experiences are very different than mine. Yeah.
parents are different people, kids are different people. How they match matters. Um, so humility, listen, listen to the kids, listen to the parents. Don't assume you know, and always question. And when I say question, don't assume because when somebody tells you this is the right way to do something, find out why. And don't work from the assumption that you really like because an expert says it is, it's the best. It's not that you don't listen to them as the expert, but you say, okay, but why? And you dive deeper, because I think it's really important to critically question, particularly any type of system as a social worker, saying, is this system really serving the best needs of the people in front of me? And many times it's not.
Hmm.
Many times the goal of the system is to create social control. And that control is not what's best for the parents or the kids in your care.
Right. It's what's best for the powers that be.
That's right, because they want to keep people, and
Yeah.
want to keep people
So
in control.
it's really important for students to continue to develop their critical thinking and to continue to stress and work out that muscle, per se, to always question things. And they're not always going to be bad, but to always be thinking, or playing devil's advocate, rather.
Absolutely. I think that's the best gift you can give as a social worker, um, to yourself and to your clients, is to always be willing to question, say, well, why is it done this way? And, when you find the answer, if you don't like it, then that's a point of advocacy and change.
Yeah. Well, I really appreciate you taking the time to talk with me today, Dr. Moon. Two things before we wrap up. Can you tell me about your backdrop and about Beeswatha?
Yeah.
And then, second of all, tell us about Myrtle.
Okay. Well, Myrtle's here too. So,
Introduce us to Myrtle.
okay, BSWAT is the Bachelor's of Social Work Student Association, and I am their advisor. And because we are in COVID times, I let them choose my background. So every time I go to a meeting, I can advertise whatever they're working on. They do various community service projects and professional development things. And, they've even managed to have fun during COVID and get some good work done, which I'm very proud of them for. They work very hard. And I will give you Myrtle. This is Myrtle. Hold on. This
Oh,
Myrtle is 2 years old. Myrtle is an unofficial emotional support dog at the School of Social Work. She It
Sometimes you can hear her yipping in the hallways, and
and
that always warms my heart because I know that Myrtle is near.
right, and when students have a bad day or we're having exams, sometimes Myrtle comes to visit and she lets people pet her and she gives them snuggles and kisses and helps reduce stress.
Yeah. And actually, this is another great example of self-care too. We laugh about our pets being like our children, but really they are a source of self-care for us.
Mhm. Absolutely. And, another thing is, there's a whole area of social work dedicated to human animal interaction. And pets are part of the family. And as social workers, we, it's more of an emerging science that we're looking at where we're really starting to look at that and their impact on well-being. And they have a really great impact.
Right. Well, thank you, Dr. Moon, and thank you, Dr. Myrtle, for joining us today.
He has an honorary doctorate in snuggles.
All right. Thank you.